Listen to me. If you are retired right now, or if you are staring down the barrel of retirement over the next few years, I need you to pause whatever you are doing and look me in the eyes. We need to have a serious, unfiltered reality check about the single biggest threat to your financial freedom. It is not the stock market going up and down. It is not what Congress is doing with tax brackets this year. It is the silent, compounding, absolutely devastating monster that is rising healthcare costs. It is quietly, systematically destroying retirement plans that people worked 40 years to build. And the worst part? Most people have absolutely no idea it's happening until it is far, far too late. Let's look at the brutal truth. Right now, the average 65-year-old couple retiring needs an estimated $345,000 just to cover their medical expenses throughout retirement. Take a deep breath and let that number sink into your soul. $345,000. And let me be clear, that does not include the cost of a nursing home, assisted living, or long-term care. That is just your basic premiums, your co-pays, your deductibles, and your prescriptions. If you are an individual, you are looking at around $172,500. But here is where the problem becomes an absolute crisis. When I ask people how they plan to pay for this, do you know what the number one answer is? Susie, I have Medicare. I'm fine. Oh, my mistake. You think Medicare is free? You think Medicare covers everything? Let me tell you right now, that is a dangerous, catastrophic lie you are telling yourself. Medicare was never designed to cover 100% of your costs. It is a system built with massive gaps. Original Medicare operates on an 80-20 cost-sharing model. That means after you meet your deductible, Medicare pays 80% and you are on the hook for the other 20%. And guess what? Original Medicare has no out-of-pocket maximum. If you get seriously ill, that 20% can wipe out your entire life savings in a matter of months. At the same time, the Social Security Cost of Living Adjustment, your COLA, is barely moving the needle. In fact, medical costs are rising so fast that for many retirees, the increase in their Medicare Part B premiums completely swallows up their entire Social Security raise before they ever see a single dime of it in their bank account. It is a losing game unless you change how you play it. So the question you must ask yourself right now is this: how do I protect myself? How do I stop my retirement plan from being destroyed by these costs? First, you have to understand exactly what you are up against. If you retire before the age of 65, you are in a major danger zone. The average retirement age in America is 62, but Medicare doesn't kick in until you turn 65. What are you doing for those 3 years? If you are relying on COBRA, or buying private insurance on the open market without a plan, you are bleeding cash. You have to bridge that gap intentionally. Second, you have to look at how you are structuring your health coverage once you are on Medicare. You have two main paths, and a mistake here will cost you thousands. You have Option A, which is original Medicare paired with a Medigap policy and a Part D prescription drug plan. Then you have Option B, which is Medicare Advantage. These plans are heavily advertised on television, usually by some celebrity telling you about all the free extra benefits like dental or vision, and how they have a $0 premium. Listen to me, nothing in life is free. Medicare Advantage plans are run by private insurance companies. They keep their premiums low because they restrict you to a specific network of doctors. If you get a serious illness and want to see a top specialist out of network, you will pay through the nose. They also require pre-authorizations for procedures that original Medicare would approve automatically. I am not saying Medicare Advantage is always bad, but if you choose it just because it's cheap today, you might find it is incredibly expensive tomorrow when you actually get sick. And once you are in a Medicare Advantage plan, it can be very difficult to switch back to a Medigap policy later because private insurers can look at your pre-existing conditions and deny you coverage or skyrocket your premiums. So what is the actionable takeaway? What do you need to do today to take control of your financial destiny? If you are still working and you have access to a high-deductible health plan with a health savings account, an HSA, you need to max it out right now. An HSA is the ultimate, most powerful financial tool in existence. It has a triple tax advantage that no other account can match. The money goes in tax-free, it grows completely tax-free, and when you take it out to pay for medical expenses, it comes out totally tax-free. Do not use your HSA to pay for minor doctor visits today if you can avoid it. Let that money sit. Invest it. Let it compound for the next 10, 15, or 20 years so that when you retire, you have a massive, tax-free bucket of money dedicated solely to covering your healthcare costs. If you are already retired, your action item is to do a rigorous annual review of your coverage during the open enrollment period. Do not just let your plan automatically renew because you are lazy. Drug formularies change every single year. The medications you take might be covered under Tier 1 this year and jump to Tier 3 next year, costing you hundreds of dollars more per month. You must shop your Part D or your Medicare Advantage plan every single year to ensure you are getting the absolute best price for the specific care you need. You also need to look into long-term care insurance or hybrid life insurance policies with long-term care riders. Since nearly 70% of people over 65 will need some form of long-term care, and a private room in a nursing home can easily cost over $120,000 a year, you cannot afford to ignore this. If you are in your 50s or early 60s and in good health, this is the time to look at locking in a policy. If you wait until you have a health diagnosis, you will be uninsurable. My friends, your money and your health are inextricably linked. You cannot have a secure retirement if you are blind to the reality of medical costs. Stop guessing. Stop hoping for the best. Take out a piece of paper, look at your retirement budget, and specifically allocate a growing line item for healthcare. You worked too hard, for too many years, to let your hard-earned wealth be quietly taken away by medical bills. Be strong, be smart, and protect your tomorrow by taking action today.